Yeah, I'd like to bring in our first guest, actually. I've got Kate Hall, Executive Director with Corporate Healthcare Coalition, and Richard Stover with Buck Consultants. They are both part of the Alliance to Fight the 40, which is the Cadillac tax, and it's a coalition of employers, healthcare companies, and many other stakeholders in this industry. And Kate and Richard, welcome to the program.
Thank you.
Yep, thank you very much.
Yeah, nice to have you here. Would you both just do a brief introduction of yourself and your role in the Alliance, and then we'll talk more about the Cadillac tax and what your group's doing?
Sure. My name is Kate Hull, and I'm Executive Director of the Corporate Healthcare Coalition, which is a small coalition of large self-insured employers who have been in existence for a number of years. It's a public policy advocacy group, and mainly centered around employer-sponsored coverage issues, whether ERISA or, as we're discussing today, some of the Affordable Care Act-related issues with respect to the Cadillac tax. And we are a member of the Alliance to Fight the 40, which I'll discuss in a minute.
And my name's Rich Stover. I'm a healthcare actuary. I have a background in training at Buck Consultants, which is a subsidiary of Xerox Corporation. And the primary focus of Buck Consultants and myself is helping employers to comply with various laws, including the Cadillac tax, so how they need to react and respond to it and what actions they can take to help mitigate the impact of the tax.
Yeah. Thank you very much, both of you. Kate, go ahead. Give us kind of an overview of the Alliance to Fight the 40, why you guys are here, and let's talk about some of the concerns and some of the initiatives that you're pushing forward.
Sure, absolutely. The Alliance to Fight the 40 is a broad-based coalition comprised of public and private sector employer organizations, unions, healthcare companies, businesses, and other stakeholders who support employer-sponsored healthcare coverage. I think the formation of the Alliance is really a sign of the growing recognition, as Rich will discuss in a minute, of the broad impact that this tax will have and is already having on employers and employees. As structured, the tax casts such a wide net that even average plans will eventually hit the tax thresholds over time. So that is one of the core goals of this group, which is to repeal the tax as it currently is structured.
Kate, it's Ron Bachman here. Before we bring Richard in to give some additional background on it, why is this such a problem? There's been it's a big tax, 40% on the excess over a limit that was built into the Affordable Care Act. I guess the original thought was to try to be sure healthcare expenditures are kept down in some ways, but it also was to help fund some of the other aspects of the Affordable Care Act. But I understand there's a bipartisan support for getting rid of it. Why is there a problem or an issue getting rid of a tax that's going to be so devastating to healthcare plans?
Well, I think that, and again, as Rich can further elaborate on, I think that this is, as you stated, the goal was to, get after a group of plans that may be providing, very high-end benefits. But the way that the tax is structured, it's a sledgehammer approach because it's not only, it's basically attacking the very tools that a number of employers use to keep down healthcare costs, whether it be on-site medical clinics or employee wellness programs on down the line. And so I think that that's the concern, that there are a number of things that count toward these tax thresholds the way it's currently structured, let alone the fact that in certain geographies you'll have higher cost areas and potentially sicker pools of workers that will all contribute toward what is counted toward this tax. And so I think that the goal of trying to reduce healthcare costs is not really achieved here. You're actually, the tax actually focuses on those very tools and instead will inevitably result in a shift, just a decrease in benefits and a shift of the costs onto the worker.
Yeah. Rich, along the lines as Kate's outlined, and to the point, the way the law is written, or the way it's written right now, it will penalize companies putting HSA high deductible plans in place. Is that not correct?
Potentially. It seems that's the direction the IRS is going, but we don't have regulations yet. But as was mentioned, the tax does cast a pretty wide net over a lot of benefits, and at least an initial guidance that the IRS is issued, they say they anticipate that both not only employer contributions to an HSA, but even employee pre-tax contributions to an HSA would be subject to the tax. So that could help. HSA plans, high deductible healthcare plans, are an approach many employers are looking at to not only control costs but help to avoid or mitigate the impact of the Cadillac tax. And if HSA contributions are swept into those benefits subject to the tax, that will make that approach a little bit less viable.
Same can be said. I mean, I've talked to many about the concern about FSAs too. That FSAs, depending on how the final ruling comes down, can in essence be killed if it stands the way everyone thinks it's going to stand. Correct?
Yeah. I mean, there's some coverages that we know are subject to the tax, at least based on the statute. Not that the IRS and regulations could take a different direction. For example, insured dental and vision plans aren't subject to the tax, but the law is silent on self-insured dental and vision, and the IRS has said that they anticipate not applying the tax to self-insured dental and vision. Similarly, in FSA, the statute specifically mentions FSAs as being subject to the tax, even for employee contributions. And while many employers may have done projections of the cost of their plans out to 2018 and found that on their basic medical plan they might not be subject to the tax, when you layer an FSA on top of that, many plans will trigger the tax. And what that will do in 2018 is cause many employers to either have to totally eliminate health FSAs or start to cap what employees can put into FSAs, and then it starts to become a question of how meaningful is that benefit. So yeah, FSAs, at least under the current law and the direction the IRS is heading, have a very short shelf life.
Right. Kate, you're there right in Washington. What's your read of the political aspects of this, of getting the votes? And a lot of times Congress doesn't act until the last second. What's your anticipation of the process of getting rid of this, or the likelihood of even getting rid of it? What's your take in Washington?
Well, it's interesting. This issue has gained traction over very quickly over a short period of time, and I think what we've seen is as you said, there's bipartisan support in both the Senate and the House. There are a couple of bills that have been introduced in both the House and the Senate. In the House of Representatives, I believe they're closing in on well over 250 co-sponsors. And then the Senate, it's a smaller number of co-sponsors, but again, still bipartisan. The repeal of the tax actually was included in the reconciliation bill that was just passed by the House of Representatives a few weeks back. The Senate is working on its own version of a reconciliation bill, a budget reconciliation bill, which we anticipate will probably include the repeal as well. However, it's pretty clear to those here in Washington that reconciliation bill will not be signed by the president. So then the question becomes, what's next? Obviously, we're entering into 2016, which is a big political year and a presidential election year, and the anticipation is that some big policy decisions might not be made necessarily in Congress while the elections are ongoing or the election season is ongoing. I think what this all sets up for is a pretty substantive year in 2017, depending on who's in the Oval Office. And we've already heard from a number of the presidential candidates as well that this is a tax that needs to be repealed. And obviously the floor is open as far as what, if anything, they might replace it with.
The Cadillac tax is affecting a large part of the marketplace. It'll likely, since it doesn't really have a geography attached to it, it's going to hit the high cost parts of the country first. It may not hit Iowa and Wyoming, the rural areas, as much as it's going to hit New York State and California and other areas out there. What's the impact that you're projecting on the different geographies, and what's that playing into the politics of this?
Yeah, this is Rich. From my perspective, it's not just geography and certainly plan design, but demographics as well of the employer. So you could be in a.
So if you have an older population on your employees, it's going to hit you more.
Now there are. The statute does include a provision to adjust the thresholds to reflect higher morbidity, either through age, older employees, or through a more heavily female workforce. and the IRS has issued some initial thoughts on their direction there. So some aspects of differences in demographics may be able to be adjusted in the tax to help not hit those employers quite as hard. But even with those adjustments, just the underlying morbidity of the workforce and the type of industry you're in, as well as geography, can impact a bit. But you are absolutely correct. If you're in some higher cost areas like the New York City area or Miami or California, this tax is going to hit you more severely than in other parts of the country, which gets back to, I don't know quite the right term, but the fairness, so to speak, of the tax. It's really not addressing plan design as much as it is underlying health care costs, which in many cases employers are limited in what actions they can take.
Okay, let me ask you about the Alliance, and Richard, jump in here as well with thoughts you have. The Alliance is, it's the Alliance to Fight the 40, so you've very much targeted this Cadillac tax. Is this a coalition, an alliance of folks that might be able to work on more than just that one issue, or if you're successful on that one issue, you've developed a relationships and a trust among each other to go after some other aspects of the Affordable Care Act that may be preventing people from getting the kind of coverages they want? One I'm thinking about in particular is the ruling by Health and Human Services that an employer cannot contribute through health reimbursement arrangements to the purchase of an individual policy that, in my opinion at least, would help solve a large part of the uninsured among the working poor in small groups. So are you getting ready, or are you already working on other issues that have the same kind of concerns for proper insurance and fairness that the Fight to 40 group is doing?
Well, that's a good question. I think as of right now, the Alliance to Fight the 40 is solely focused on that particular, the Cadillac tax. But, in Washington, relationships are always forming all the time, and that's what, is the basis for future efforts. So who knows what that could lead to down the road. But for as of right now, the Alliance to Fight the 40 is strictly focused on the 40% tax.
And Richard, I love having another actuary on the program here. I'm an FSA myself, or at least a recovering actuary, recovering partner from PricewaterhouseCoopers. Are you doing some modeling for the Alliance so that they can show legislators there the impact on their particular districts or their particular state, the impact, and sort of helping with the numbers side of it? Is that where the buck roll's coming in?
Yeah, we've assisted in looking at different scenarios and how the tax works. I mean, one example I'll give you kind of early on was many employers have multi-tier benefit programs, meaning that they don't just have contributions for employee versus family, but the contributions might vary for different sizes of family. And without getting into the detail, that's a very important issue that has a very significant impact on the tax. And what Buck did early on was model for the IRS different scenarios about the impact of family tiers. And in the notice that the IRS issued, hopefully that input helped, because the guidance gives employers some flexibility to look at family tiers in a way that helps to better reflect the tax and basically reduce the amount of tax employers would pay. So yeah, we have looked at different types of populations and groups and some inequities in the tax to hopefully get some relief in the guidance if the tax goes forward for employers.
Having worked in Washington on legislation myself over the years, one of the first questions any politician asks is who's for it and who's against it. Who is for retaining this tax? Have you identified, are there groups out there that are promoting it, that are doing modeling on their side and saying really it's not going to cost as much, or we can't afford to give it up because we're going to get this extra revenue from it? Who's on the other side of the debate here?
Well, that's a good question, and I think that there are those who were involved in the construction of the Affordable Care Act who are concerned about the funding that would be displaced as a result of repealing the excise tax. So I think that there are some who are concerned about what impact that will have on the law, and I think also there are some folks who are concerned about or concerned about how to pay for a repeal. So that's again another issue that has come up in discussions. But I would say that there are also, there's a school of thought amongst some economists that this is important to reducing costs. But as both Rich and I have said, we believe that that's not exactly the way that this is going in terms of that might have been the intended impact or effect of the tax. But in reality, what we're seeing is that it's, in fact, causing some massive upheaval in the employer-sponsored market, and will ultimately impact employees.
Let me ask sort of a little cynical question, and you can respond one way or the other, Rich, as well. Some might say that this tax is so onerous and is so will throw the market into such upheaval that benefits won't be what people need. The employers won't be able to offer what they would like to offer. It won't have the ability to engage people because we'll be getting rid of some of the incentives through HSAs that employers would put in, and that the ultimate goal here by some who would say, let's don't get rid of this, is that they really want a single-payer system so the government can come in and say, hey, listen, let's just get rid of all this problem and confusion. Yeah, we created it, but they'll never admit that. And then say, let's just go to a single-payer system. So is this part of a broader approach to get to something that maybe was targeted originally by the advocates of the Affordable Care Act?
Well, speaking as an actuary, I can't say if that specifically was the objective or not of the tax, or a hidden objective of it. But in the long run, that could certainly be a result. Some actuaries have done projections, for example, that show ultimately the way the tax is structured to meet the ACA requirements, to offer a plan that meets certain requirements under ACA. All employer plans will be subject to the tax, and employers don't want to pay the tax, so you kind of get in a conundrum there. So I think over time, if this tax stays in place and increases over time as it would under the current law, I think you'll see potentially the same kind of thing you saw on the DB side, defined benefit pension plans, that, with this tax and other onerous compliance requirements and reporting requirements, more and more employers may just stop offering benefits, and at some point a single-payer system may be needed so that individuals do have coverage. So you can certainly view that as perhaps a long-term result, whether or not it was an objective or not of the tax.
Kate, tell our audience that may be interested in getting involved to fight against the Cadillac tax, how they do that. How do you urge them to do that, please?
Well, sure. Obviously, the Alliance to Fight the 40 is a great venue for that. www.fightthe40.com if you want to learn more about the Alliance. I would say that I think the greater business community also here in Washington is very involved. Similarly, the Chamber of Commerce, et cetera. So I think that there are a lot of groups who have realized that this is a big problem now, and are trying to get the attention now before this goes into effect in 2018. So, I'm sure that the Alliance is a great forum, and I think that reaching out to your members of Congress and urging them to support the bills in Congress would be very helpful as well in trying to continue to build on that support. Obviously, that's what's gotten us to where we are today as far as having so many co-sponsors on the House and bipartisan bills on the Senate as well. So I think that, reaching out to your legislator, tapping into some of the efforts of the groups that I just mentioned will all be very helpful. I think that the more folks are hearing about the widespread impact of the tax, the better.
Yeah, I think it's very very important that we all really understand the details and the ramifications of this tax. And I thank you both, Kate and Rich, for joining us today. You have a great weekend.